The U.S. now has more reported cases of the coronavirus than any other country in the world. Think about that for just a second. There are more than 85,000 across all 50 states. The death toll is about 1,300. There are stay-at-home orders in at least 23 different states.
New York City remains the national epicenter of the pandemic. It has more than a quarter of those sickened so far, and this is overwhelming the city's hospitals and first responders. Our lead national correspondent, David Begnaud, is in New York. David, good morning. What are you hearing?
Tony, the number of hospitalizations here in New York jumped 40% on Thursday, just in a 24-hour period. We continue to make calls to doctors and nurses around the city who are telling us harrowing stories of what's happening inside. But I got to tell you, a lot of them don't feel comfortable talking on camera because they're worried about either being fired, and some of them are worried that their hospital may not tell the truth of what is happening inside. But there are some who do feel comfortable coming forward, and that's where we're going to start this morning.
The hospitals look like a war zone.
Dr. Ibad Yusuf of Brookdale Hospital in Brooklyn says the emergency room is overwhelmed, and medical staff he's been talking to across New York City are describing similar scenes.
People lining up out of the hallway, through the EMS bay, through the ambulance bay, with masks on themselves, with oxygen on their nose, with oxygen on their face.
Elmhurst Hospital in Queens saw 13 people die in 24 hours on Wednesday. To relieve the overcrowding, some patients have been moved to other facilities, and the hospital has added more than 50 additional staff.
People come in, they get intubated, they die, the cycle repeats.
It's just a catastrophe.
Mariah Sharon's 48-year-old brother, Caius Kelly, worked as an assistant nurse manager at Mount Sinai in Manhattan. As a child, he suffered from severe asthma. He died after testing positive for the coronavirus. He didn't want his parents to know, so he sent his sister a text saying, "Can't talk because I choke and can't breathe." He was on a ventilator then. The last thing he did was send her an "I love you" emoji.
The sentiment from inside the workers of that hospital was that he was unnecessary, as well as everyone else there, unnecessarily exposed. And essentially, it could have been prevented.
Yesterday, in a 24-hour time period, we did over 6,500 calls, which is a record for EMS.
Anthony Almagera is a senior executive with an EMS officers union in New York. He says emergency workers are being stretched thin, and he is afraid of the exposure his workers are facing consistently. This is what his worst-case scenario is.
Somebody dies. A paramedic and EMT is going to die. We have members who work with us who have underlying medical conditions. We have them go home. You know, if they go home and grandma is home and they have emphysema, grandma gets it. Grandma dies.
Regarding that nurse who died at Mount Sinai Hospital, I want to let you know that a doctor sent me an internal memo from the hospital which says, "We have always provided and will always provide our staff with proper protective equipment, and we have an adequate supply." We also heard from a doctor who says he tested positive, went home for a week, had no fever for 3 days, and was asked to come back to work. So we wanted to know, what are hospitals telling their doctors? So we called 20 of them around the city. We heard back from 8, and this is what they told us. If a worker has symptoms, they go home for 7 days. But once that worker is asymptomatic, has no more symptoms, and once they're fever-free for 3 days, they can come back to work, even if they're positive.
Oh boy, David, that is so hard to hear. It's really tough when even the people that we need to help us now need help. It's a very, very, very troubling situation. Thank you very much.